My name is Shelley Sims, and I'm 44 years old, and at the age of 32, shortly after I had my son, I was diagnosed with primary progressive multiple sclerosis. It's rare actually to be diagnosed with that right off the bat. I think that's a very small percentage, but yeah, I don't have the ups and downs like other people with MS. It's just the same unless it gets worse. The first symptoms I had were fatigue and loss of balance, and I would have pain and numbness and tingling in my fingers and my toes. Sometimes I would just, fall down for no apparent reason. And pain in my legs, actually, they were like, first thought maybe it was like blood clots or something like that. And the first doctor actually told me it was because I had just had a baby, but I thought, nobody would ever have a second child if it felt like this. I took medications to help me sleep. I took medications to help the spasticity in my muscles because that was what kept me from sleeping the most, is my muscles would stay tight all the time. I took muscle relaxers. I took pain medications. I took medications for headaches. I took a medication, I don't remember what it was called, but what they give cancer patients to help them have more energy. I took one medication that you would see on TV that they give to elderly people to give them more energy. It just, every symptom basically they would, generally offer up a medication. My grandmother actually called me, and she had seen in her small town newspaper that a lady was doing a fundraiser and she was going to have this done in Costa Rica at the time. And she, and it was for multiple sclerosis as well. So she contacted them and had the person's name, and then she called me, and that was actually the first time. I had heard about stem cells just kind of in passing, but I didn't know a lot about them. But that's actually how I got in touch with this group of doctors, and then they helped me get in touch with other people like Richard Humphreys and people who had it done where I could talk to them individually. I think the thing with the clinic that I was the most impressed with was how clean it was, how particular they were, even about, all doctors and nurses are supposed to, be very methodical about hand washing and keeping everything clean, but they were, extremely so, where, if they had washed an area and they were fixing to give a shot, if anybody was even near that area, they were re-washing it. They were doing what everybody should do here, but that you don't always see. We all kind of said if we could get one thing back, what would we want it to be? And for my husband and I, we were hoping that it would help the fatigue. For my parents, they were hoping for me to cut down on the pain medication because they kind of felt like that was the root of all evil. And for my son, he wanted me to be better at video games. That was his big goal. And so, for us all to be able to say that, everybody kind of got their wish plus some is just something I would have never, even been able to even realize. I don't think that I could have grasped that was even possible. I was on 13 medications when I went and had it done. Now I take 2 daily medications, one pain medication, which is actually half the dosage that I was on before. And then I take a low-dose blood pressure medication, and then I take like a PRN medication for migraines on occasion. Everything I got back has stayed at the same level since then. So, I played last week, played racquetball with my son 2 days that week. I coached his basketball team. So, I'm able to be active and do things that for his entire lifetime I've never been able to do. He never was able to see me do those things before.